My name is Alex Halper. I'm the Senior Vice President of Government Affairs for the Pennsylvania Chamber of Business and Industry. The PA Chamber is the largest broad-based employer advocacy association in Pennsylvania. We represent about 10,000 businesses statewide, crossing all industry sectors, businesses of all sizes in all 67 counties of the Commonwealth. As you all know, the business community is a diverse, eclectic group, but one of those factors that are a common thread among all are their obligation to maintain workers' compensation insurance, either through an insurance policy or as a self-insured employer. And it's for that reason that we're especially grateful to Chairman Dawkins and the committee for scheduling this hearing today to talk about a critically important topic that has become even more apparent since the Federated versus Summit decision, but overall on the topic of workers' compensation and prescription drug costs, which has long been a challenging area for the business community. Workers' compensation and overall workplace safety is a top priority for the business community. Employers invest considerably in workplace safety, and that has led to overall improvements in workers' compensation in terms of overall claims and workplace accidents, as well as overall average statewide system costs, or in the industry, the loss cost. Over the last really couple of decades, Pennsylvania, after a period of significant fluctuation and spikes in loss cost or overall costs in the workers' compensation system, Pennsylvania, since really the mid-90s, has seen a stabilization, which has been generally beneficial on average for Pennsylvania businesses. I'm making the point that these are averages. This is aggregate and sort of overall data because while the number of overall claims has been steadily decreasing in Pennsylvania, and again, that is a product certainly of an evolution in our economy as we move to a more service-based economy, and workplaces are just generally safer. It's also the investment I mentioned of employers in workplace safety. While that reduction in claims has occurred over the last couple decades, at the same time, the average cost of individual claims continues to increase, and in most cases increasing beyond just the regular rate of inflation or inflation in the healthcare sector. That means for individual employers, the costs that they bear for workers' compensation, even as statewide costs might be stabilizing, for an individual employer, their costs might be increasing, and as we see and certainly hear anecdotally from employers, those costs might increase significantly. Part of what determines an individual employer's workers' compensation cost or their premium, part of that is based on their experience. The more claims they have, the higher the cost of individual claims, the more they're going to pay, just like most insurance products. And that has certainly been the case in workers' comp. So we look at reasons why individual claims cost might be spiking, and without a doubt, prescription drugs continues to be an area of focus. I won't belabor or repeat the statistics that Mr. Karn mentioned, but we certainly have been paying attention to recent reports from the Workers' Compensation Research Institute. WCRI is a valuable tool because it's a national analysis. They are looking objectively at all states, and Pennsylvania. I did print out one of the graphs from one of their recent reports showing states and individual prescription drug costs in workers' comp, and Pennsylvania is at the far right end, and I included that in my written testimony. But the bottom line is Pennsylvania is an outlier state when it comes to prescription drugs in workers' compensation and prescription drug costs, and that big picture really why we're grateful to the committee for focusing on this issue. Again, I know today's topic is this court decision, the Red Book. That no doubt is a key reason, I think, why Pennsylvania prescription drug costs are an outlier, but it's also part of a bigger picture. And those of you who have been in the legislature for over 10 years know that this has been a perpetual topic. A number of years ago, there was an emerging trend of physician dispensing. So, a small number of physicians that were dispensing the medications that they were prescribing from their practice, and other objective analyses were showing that that was changing prescribing patterns and significantly spiking costs. Legislation was passed ultimately to address that situation, and we've seen that trend decline. But at the same time, it has been shifted into other prescriptions and other areas of, candidly, what amounts to abuse of the system. And happy to get into any of those, but we do think it's important for this committee in particular to be aware of the state of the workers' comp system, and we appreciate the opportunity to be part of the discussion on this court decision and on the Red Book in particular. We're certainly sympathetic to the department, who was given a very difficult task by the Commonwealth Court, but we hope that deliberations on how we move forward and ultimately a resolution on this decision is an inclusive one that includes all stakeholders. I'll also follow up on, I think, a point that Mr. Karn alluded to, that whatever new pricing guide is selected per the court's decision, and depending, of course, on how the Supreme Court rules now that they've agreed to hear the appeal, that will likely cannot be the end-all, be-all of this discussion. Other factors will be relevant to how drugs are priced, to how we can have reasonable safeguards on prescription drug prices, all with the number one priority, of course, of the individual and the patient, the employee, who needs prescriptions to get them back to full function, back to full health, and back to work. I know we all agree as soon as possible. So thank you again for the opportunity to be part of this discussion. Happy to answer questions when the time comes.